Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752. What do you think, Dr. Darrow? Do you want to go to the phones?
I think I'm living it up, as always.
I think you are, too. Shall we go to Mark, or do you want to say something first?
Well, I always like to say stuff first, but Mark, don't go anywhere. And Pete also, and the other callers, please hang with us. So what we're talking about today is what we call regenerative medicine. It started back in the day called proliferative therapy. And that in those days, we just used sugar water, concentrated dextrose, to inflame an area and bring fibroblasts to the area, which grow back tissue. Today, it's much more advanced. It keeps morphing through the years. We got platelets for a while, and called PRP. We're still doing that, but we also add stem cells to it. So if it morphs into something else later today, I'll learn that. I keep trying to be on the edge, cutting edge of healing, and we treat all over the body. And for you, Mark, it looks like your elbow is bothering you. You want to give out the phone number, and then we'll get right to you and your elbow. And then, Pete, you stick around your left arm and your armpit. Okay. So the phone number to the studio to talk to me live right now is 866-870-5752. I'll repeat it. Write it down. 866-870-5752. And I will mail you out a free copy of my book. It's a couple hundred pages long. It's got photographs of different parts of the body being injected, a little anatomy, and also one of the most important things, took me 5 years to compile all this research on how regenerative medicine works, how it actually grows back your tissue, rejuvenates your body instead of cutting it out. And there's, actually I'm looking here right now, it's 264 scientific studies on this, okay? So I'm not making this stuff up. It's something that is being studied more and more now. There's more and more doctors learning how to do this. The book itself has a foreword by the lovely Suzanne Summers, who I've worked with for years on her body and her family's bodies, helping them heal. So, Mark, I understand your elbow bothers you. How long ago did that start?
Hi, Dr. Darrow. This started in mid-April.
Okay.
I was arm wrestling a student.
Oh.
Which I won't do again. And then after that, I couldn't even pick up a cup of coffee with pain.
I've been there.
And and so I actually got an MRI, and I'll read you the one brief sentence for the impression. It says, mild common extensor tendinosis with focal low-grade interstitial tear at the origin. And I'm wondering if the regenerative therapy you do would help that.
All day long.
Okay.
Yeah, I do elbows. I just did one yesterday, as a matter of fact. Yeah, we do elbows almost every single day. But the best part of all this is I love healing other people, but I love healing myself. And at different times of my life, I've had that also. That's called lateral epicondylitis, or tennis elbow, where the extensor tendon attaches to the lateral epicondyle. And that's called tennis elbow because people who play tennis who are not pros snap their wrist on their backhand and extend their wrist back and fire off that muscle, which pulls on the connection of the muscle to that part of the bone by way of a tendon. And tendons connect muscle to bones, and ligaments are the same kind of material. They're just collagen strips that attach bones to bones. But it's the same kind of an issue. And having that little interstitial tear, interstitial means in the tissue, means nothing. It's not a big deal. we treat those all the time, and I can't say I can promise you anything because you have to be a good patient too and leave it alone, let it heal. But
Yeah.
those heal up really fast and well, and I've had that on both my right and my left elbow at different times. Miserable pain, hard to even pick up a pencil, and mine was from weightlifting and golf, both. And people say, well, shouldn't you have a golfer's elbow? Golfer's elbow is the medial epicondyle, the middle part of the elbow, not the lateral part or the outer part that you have. But you can get anything from anything. It's not just the sport you're doing. And the first time it happened to me, I was at Rancho Park at the driving range hitting off of these mats, which are on concrete. And I was there for a few hours. I'm an exercise fanatic. I love repetitive sports. And then I went to my office, and we had a gym there at the time. And as soon as I did some curls, I felt it didn't pop, but it felt like it popped. And that was it. It was some of the worst pain I've ever had. But I healed it up just self-injecting myself. And so I have very, very high hopes that I can get your elbow healed in a very short period of time using probably just platelets from your blood. We might, if you decide you want a faster, quicker, better healing, you might add stem cells to it, but that's something we can talk about when you come in.
And Dr. Darrow, can you give me like a grade school explanation of how the therapy works? I mean,
yeah.
So I guess you're taking something out of my body. So where do you take it out of my body, and then I guess you inject it? Could you just go over the process a little bit on a simple level for me, please?
Of course. It's a very simple process, and I'm a simple person. That's why I like this work. No, it's true. I always loved orthopedics because it just made sense to me. It was always simple. And I was in training to become an orthopedic surgeon. And back in the day in med school, I did tons of rotations in orthopedic surgery. I even was so into it that I would go into surgeries. I'd call every orthopedic surgeon in town and beg them to let me go into surgery with them. I just loved it so much. And then in my fourth year of medical school, when I hurt my shoulder weightlifting, I begged my professor, who I was doing a rotation with in orthopedic surgery, to operate on my shoulder. And I loved the guy. And it came out bad. It wasn't his fault. It just came out bad. It just happens in surgery. And my arm was filled with fluid like a balloon, and I had a high fever, and I was terrified. And it didn't heal. It was like 4 years of misery. I mean, it got better, but it never healed. And then I learned about doing prolotherapy at my residency at UCLA, and I injected myself, and it healed overnight. And that was the great awakening in medicine for me. That's when I decided that regenerative medicine was going to be the work that I do. But anyway, it's very simple how it works, Mark, and thanks for asking. We do these days, there are some guys who just still do prolotherapy. That's the concentrated sugar water, concentrated dextrose. And there's nothing wrong with it. It's just, in my experience, it's not as powerful a treatment. So I rarely do it. There are people that ask for it, and occasionally on myself, if I'm at home, I can do that. I just take out a bottle of dextrose and lidocaine, and I mix it up and inject myself. But I didn't finish after the break about my dog Dakota. Hit me on the left side of the knee running full speed. He was 85 pounds. And he hit me on the outside of the knee, the lateral side, but the medial side, the middle side, is where I felt the pain, which meant I was in bad trouble. That's called O'Donoghue's terrible triad. You can look that up. And it affects the medial collateral ligament, the medial meniscus, and the ACL, the anterior cruciate ligament. So I'm going to use the word screwed, and I limped off the field, and I went to my office and I injected myself with prolotherapy because it's easy, it's simple. I just pulled out a couple bottles and injected my knee. And the biggest problem was the retinaculum, which is the covering on the patella, the front bone of the knee, had been loosened up. So my patella was loose. And every time I moved my knee, it would catch. So I injected all around the patella, about probably, I'm going to say 25 or 30 pokes around the patella with a tiny little needle. And it tightened it up. Immediately it tightened it up. And then I went out to run a few days later, and it was better, but it would come loose again. And I did that literally about a dozen times. And each time the same thing would happen. It would tighten up. I'd think I'd be okay. I'd start running. I was fine. And then when I'd sprint a little, it would loosen up. So I decided to bite the bullet, as we say, and have my staff draw my blood. And I did PRP one time. That did it. That completely healed it up. And I was able to sprint again. I live in the mountains in the Palisades over the ocean. And I run up and down the hills here. So I love, I'm 75, man, but I still love sprinting. It gives me such a high. I don't go far. I only run about a mile a day. But, having the Huskies with me, Dakota's not running anymore. He can barely walk. But Bella, my younger Husky, who's about, I think she's 12, almost 12, she's still fast, and we go out together. And I can basically outrun her. I just love it so much. But I do, I think it was a year or 2 years ago where I really hurt my knee sprinting, and I had to do some stem cells on my knees, both of them, and they healed up. I'm doing fine. But I was on crutches for a while, Mark, so I know what pain's all about. But anyway, the actual way it works is simple. If we're going to use PRP, which is what you asked about, we just draw some blood from your arm. It's very easy.
Okay.
And we spin it in a centrifuge, and there's a certain way we do it, and then we throw away the red cells. We separate it out. Because, for example, if it's a knee, you never want to put red cells into a knee because they're very, very inflammatory. And if you do that, you're going to end up with an effusion where the knee blows up with fluid, and then you have to aspirate it a few times. It's not worth doing that. So the platelets have a lot of good cells in them, and we inject those. And they have growth factors and cytokines and things like that. And they actually stimulate tissue to grow. So that's one of the mechanisms how it works. The other mechanism, just like the old prolotherapy days with dextrose, is it creates a little bit of an inflammatory cycle. And the inflammation draws fibroblasts from all over the blood into that area. And fibroblasts actually are the cells that are growing tissue. They spit out collagen. So those are the basics. We can also go into the bone marrow and take that, which has stem cells and platelets in it. And that is, once I numb up the area on the back of the pelvis, that's about a 15-second procedure. I've done so many of them that I've got it down. It's not a big deal. You don't have to go to a surgery center. You don't need anesthesia. It's very fast, and that's something that I enjoy doing. And that's another way to do it. And there's other ways. There's a whole bevy of different things that can be done. It was like yesterday, I mentioned before, a woman came in with carpal tunnel syndrome, and the typical thing I'll do if the nerve is inflamed is I'll use some steroid in it. And although I don't like to use that very much, and I don't like to use it when joints are inflamed or things like that, or people have sprains, I like to use it occasionally with a carpal tunnel because it'll actually shrink that nerve down, the median nerve that goes through the carpal tunnel. But anyway, she said she said she couldn't tolerate any steroid, and she was very sensitive to everything. And I said, okay, I'll use D5W, which is dextrose 5% in sterile water. So I put together a little solution of that, and we hydrodissected under ultrasound guidance so I could watch where that needle goes and stave away those tendons away from the nerve. And I saw that right in front of me on the ultrasound, where that nerve was once again free floating without the adhesions to the tendons around it. And I'm going to give her a call after the show and see how she's doing today. Hopefully it's better already. So that's basically how it works.
Well, thank you for explaining the process, Dr. Darrow. I'll call your office on Monday.
All right, great. And I just had another thought, which is important. Yes. A lot of people come into orthopedic surgeon's office and they get hyaluronic acid injections. And to me, that's just not smart, because when you do what I do, it actually creates hyaluronic acid naturally anyway. And most of the people I see that have knee problems already have too much hyaluronic acid in their knee. They have what's called an effusion. So one of the first things I do when they walk in is I lay them down on the table, put the ultrasound on their knee, and see if there's fluid in it. If there is, then why would you put more fluid in it? Why would you put this lubricant in it that it doesn't need? It's already overly lubricated. And the first thing I'll do is I'll aspirate out the fluid and then put their own cells back in to start the healing process. So there's not just one way to do this. It's the thing I love about this work. I do the same kind of stuff every day, but there's not a day that goes by where I don't learn something new, where a patient says, I don't want to do that. Can you do something different? Then I have to really think about it like I did yesterday and do a new procedure. I'd never done that before. And I told her, I said, I've never done this before, but I have other doctor friends that do it, and they say it works really amazingly well. And she said, well, let's do that. And that's how I started doing the work to begin with. I'd go to patients, say it worked on me. I haven't done anybody else. You want to be the first one? They go, I'll do anything except have surgery. So for me, doing this work was intuitive. I didn't have any teachers.
Mm-hmm. Well, thank you very much, Dr. Darrow.
All right, Mark, God bless you. And thank you so much for calling in. I'm going to give out the phone number. Then we're going to get to Pete with his left arm issue. So if you want to talk to me live, please call me right now before the end of the show. We got a few minutes left. It's 866-870-5752. And if you want to get a free phone consult at my office with my staff, call them right now, 800-300-9300 for a free phone consult. And by calling us, you get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. A couple hundred pages of studies on how to heal your body naturally using your own stem cells or platelets. And it's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. So, Pete, you're amazing. You've been so patient. Thank you so much for waiting.
Hello?
How long has your arm been bothering you for?
Yeah, can you hear me, Dr. Darrow?
Oh, yes, I can. Can you hear me?
Oh, Dr. Darrow, thank you for your show and your expertise. I hope you can help. Let me give you just a bit of history. 3 years ago, I had a bad case of shingles in my left scapula and left armpit.
Okay.
It was so, despite three shingles vaccine, the regions were so bad that if you looked at me 3 years ago, you think somebody applied a blowtorch to my scapula and my left arm.
You know what? That's a very good picture, because that's what it looks like. Yeah, I treat a lot of people with shingles. Yeah.
Yeah. After I healed, the post-herpetic neuralgia was just so intense.
Yeah.
And it lasted with me until now. It's been 3 years that I'm suffering with post-herpetic neuralgia.
Oh my God, that's horrific. I'm so sorry.
Gabapentin, tramadol, and the concoction from pain management that I apply. They take the edge off, but I'm writhing in pain 24/7. I can't sleep.
Right.
And I'm constantly feeling stabbed and burning sensation. I hope you can help.
Well, I can give you my history with this with patients. I can't promise anybody anything. I never do. Even if I think there's an easy case, I always tell people, I promise you nothing other than I'm going to love you the best way I can and do things that I think work. And this is one of those kind of cases where I'll use what's called neural therapy. And you can look that up. It's an old German form of injection. And the way I do it is I'll use a mixture of lidocaine, which is a local anesthetic, with a steroid. Again, I'm talking about a steroid, which I usually don't use to heal the musculoskeletal system. But it works really well with shingles in the acute phase or in the post-herpetic neuralgia phase. That's when all the blisters are gone, but there's still a lot of pain, burning pain. And what I do is I make little wheels or blebs around the area and through the area. And that usually works almost overnight to get rid of the pain. Sometimes it takes more than one treatment. So
Yes.
if you're having the post-herpetic neuralgia, come on in. We'll do it for you, and hopefully it'll work to help you get rid of that pain.
I'll be more than happy to make an appointment with your office.
All right, and the phone number to the office is 800-300-9300. Please call there now. You can get a free phone consult with the staff. And if you call right now, yeah, they're there.
Okay.
If you mention post-herpetic neuralgia, they may not even know what that is because it's not the most common thing that I do. Mostly what I do is musculoskeletal wear and tear, rotator cuff tears, meniscal tears, labral tears, neck pain, back pain, arthritis, all over the body. So so just say that you talked to me on the radio, and I want to get you right in. And
I will do that. It's 800-300-9300. Got it.
That is the office number, yes. And to call me right now, we still have a few minutes left. Call me live at 866 on the radio, 866-870-5752. Write it down, 866-870-5752. Give me a call. I'll send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. A couple hundred pages of studies, 256 studies on how regenerative medicine with platelets and stem cells can heal your body and how surgery can actually hurt your body. I'm not making a statement against surgeons. I love surgeons. They do tough work, but I don't believe in all the surgeries they do. I like the ones where it's needed. I don't like the ones where it's not needed. Who's to decide what is needed? That's another question, because the surgeons often think they need to do things that I think they don't need to do. So, Pete, anything else, any other part of your body that bothers you that you want to talk about?
No, thank you so much. I'll call right now and make the appointment with you, and I hope to see you soon.
By the way, I do have a question. You said you had 3 shingles vaccinations before you had the outbreak. Can you tell us about that?
Yes, I had. First of all, I had the Zostavax, which was the old vaccine, and then I had. And then after that, the Shingrix, which is the 2 vaccine. And it's like most people get a bad reaction. I didn't get any reactions. Like I was a non-responder to those vaccines.
Well, that's a problem. Do you want to know why that's a problem?
I was a non-responder to those vaccines.
Yeah, your immune system wasn't affected by it.
Yeah, you're absolutely correct.
People sometimes complain and they go, God, I had such a terrible reaction from a vaccination. I go, thank God. I mean, it doesn't mean you have to have a bad reaction for it to work. But that means the immune system is really putting up a fight and then is bolstering itself to take care of that. So that may have been what happened to you. That's so interesting.
Well,
Thank
maybe
you.
my age has something to do with it. I was in the 70s, and maybe my immune system was not the best at that time.
Well, that's probably true, Pete. You're probably right. And, that means that you really ought to do things to bolster your immune system.
Yeah, I mean, I'm trying to eat healthy and so forth, but I'm taking, focus factor. I'm taking multiple vitamins to try to nourish my system.
Well, there's a blood test. There's a blood test we do at our office. It's called SpectraCell. You won't find it pretty much anywhere else. Only alternative doctors even know about it. And it checks for vitamins, minerals, amino acids, and antioxidant deficiencies, which you probably have lots of by now in your 70s. Anyway, God bless you. Thank you so much for calling, and we'll see all you guys next time. I'm going to give out the phone number to the office. It's 800-300-9300. Call there now for a free phone consult with my staff. You can also go to my website at www.jointrehab.com. You can watch me do videos of PRP, platelet-rich plasma, and we're gone.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. here on AM 870, The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.